This is USVI News, your Virgin Islands connection.
Hi, everyone. Thanks so much for joining us for USVI News. I'm Emily Matson. The primary election is right around the corner, so election season is certainly heating up in the Virgin Islands. And this Tuesday, Governor Albert Bryan Jr. announced he is running for re-election. He and Lieutenant Governor Tregenza Roach filed the necessary paperwork at the elections office in St. Croix on Tuesday morning. They were elected in 2018 and took office in January of 2019. The Democratic governor was thrust into the COVID-19 pandemic just a year into his first term as governor. So spending much of his more than 3 years in office trying to control the spread of coronavirus and navigate the necessary mitigation efforts in conjunction with the VI Department of Health. So far, independent candidates have also indicated the running for the office of VI governor. Look for more coverage of Governor Bryan's re-election announcement later this week here on USVI News. We continue to see a significant spike in COVID-19 cases. It comes after thousands gather to celebrate Carnival in St. Thomas. Cases are up throughout the territory, jumping significantly on St. Thomas and St. Croix today. According to the latest numbers from the VI Department of Health, there are currently 1,076 active cases territory-wide, with 203 on St. Croix, 857 right now on St. Thomas, and 16 current cases on St. John. And the Virgin Islands are certainly not alone when it comes to rising COVID-19 cases. A new COVID alarm is being sounded, with cases back on the rise across other parts of the country as well. And health officials expect the upward trend to grow in the months ahead. Gabe Gutierrez reports.
A dire warning of a dangerous fall surge ahead. A senior White House official saying the U.S. could see up to 100 million new COVID infections. That's about a third of the population.
We're going to have a lot of waning immunity. This virus continues to evolve, and we may see a pretty sizable wave of infections, hospitalizations, and deaths this fall and winter. Whether that happens or not is largely up to us as a country.
Now, as a new highly contagious subvariant spreads, the Biden administration is renewing its call for another $22.5 billion in COVID relief money. The funding would help provide therapeutics, testing, vaccines, and boosters nationwide. This comes just days after the U.S. topped 1 million coronavirus deaths, according to an NBC News count. In almost every state, new COVID cases are on the rise, up nearly 56% over the past 2 weeks.
We are seeing new variants. And remember, we have about 50% of the country that did not get infected in the Omicron wave that is now freely out. We don't have masks, also making them targets for infection.
The Northeast being hit hard. The CDC raising several regions to high alert in states including Massachusetts, Connecticut, and New York, where New York City may be grappling with a fifth wave.
This is the time for just preparation and using the many tools that we have: masks, vaccines, frequent testing and treatment.
And as people gather for celebrations like graduations and Mother's Day.
This is a real treat, not have that fear of COVID hanging over you.
Health experts urge Americans to stay vigilant, especially those at high risk.
You may want to be more careful, have outdoor celebrations if possible, consider using a rapid test.
The CDC is lowering its threshold for a cruise ship to be considered highly vaccinated. Before, 95% of eligible passengers had to be vaccinated to reach that status. Now, it's 90%. The percentage of crew members who must be vaccinated for a ship to qualify as highly vaccinated remains at 95%. The classifications are part of the CDC's COVID-19 program for cruise ships. Cruise lines which opted into the program must share the vaccination statuses of each ship with the CDC, which posts the information online. The CDC also updated its isolation cabin requirements, with negative air pressure no longer required. President Biden is expanding high-speed internet access for millions of American households. It's part of the Affordable Connectivity Program created through the Bipartisan Infrastructure Law. So as Deborah Alfarone reports from Washington, it could bring the monthly internet bill down to zero.
High-speed internet is not a luxury any longer. It's a necessity.
Bridging the digital divide. President Biden announced 20 internet providers have agreed to speed up internet service and lower costs for millions of Americans.
If you qualify, you're going to get a $30 credit per month toward your internet bill, which which most folks will mean they get on for nothing.
The average cost of a broadband internet connection in the U.S. is $61.07 a month, according to the Organization for Economic Cooperation and Development, among the highest in the world. Providers are now capping costs for qualifying Americans at $30 a month, matching the internet service subsidy in the president's trillion-dollar infrastructure law. The need for speed became even more apparent during the pandemic with remote learning and work from home.
I think it's vital at this point to make sure that all families have that option available to them so that we don't move backwards in terms of what we learned from COVID.
The president made expanding high-speed internet access in rural and in low-income areas a priority on the campaign trail and also in his push to get the infrastructure bill through Congress.
Many states and municipalities are working to expand access, which residents in rural areas liken to keeping the lights on.
In today's economy, this is just the same thing.
Those who are receiving SNAP benefits, Medicaid, or even Pell Grants may qualify. 11.5 million Americans have already signed up.
So determine eligibility and to sign up for the program, you can call the number on your screen, 877-384-2575, or you can go to getinternet.gov. Now to several news stories making headlines across the Caribbean today. Over the weekend, U.S. Border Patrol agents apprehended 60 Haitian migrants on board a makeshift Yola after disembarking in Cabo Rojo, Puerto Rico. Saturday, Border Patrol agents spotted a makeshift Yola-type vessel making its way onto a beach. After approaching the boat, agents encountered 60 non-citizens claiming to be from Haiti, 2 of which were juveniles. They have all since been transported to the Border Patrol's Ramey Station in Puerto Rico for immigration processing and removal. And an update regarding the hotel explosion in Havana, Cuba, as the death toll has gone up. At least 35 people have now died as a result of that Friday explosion, which destroyed the Hotel Saratoga in Havana. According to a statement from the country's health ministry, 35 deaths. Of the 35 deaths, 89 people were also injured and 20 still remain hospitalized. Among the dead are 4 minors, a pregnant woman, and a Spanish citizen. Officials said Friday they believe a gas leak may have caused the blast at the hotel, and rescue workers say they also believe more victims may still be buried in the rubble. And an investigation is underway in the Bahamas after 3 Americans were found dead at a resort over the weekend. 1 American also remains hospitalized. According to the Royal Bahamas Police Force, foul play is not suspected and no signs of trauma were found in the deaths of 3 Americans at the Sandals Emerald Bay Resort on Grand Exuma, Bahamas Island. Officials said Monday samples have been taken from the 3 Americans and were sent to a lab in the United States in order to expedite the results and help authorities understand just what happened. The police commissioner of the Bahamas said officials have also collected samples from the rooms where the tourists were staying and the surrounding property to determine whether any contaminants were present. The victims are identified as 68-year-old Michael Phillips and his wife, 65-year-old Robbie Phillips, both from Tennessee, and 64-year-old Vincent Paul Shardella from Florida. Shardella's wife, Donis, survived and is listed in serious condition in the hospital. Investigators are trying to determine what may have caused their deaths.
Once those examinations are done, our pathologists would be able to provide us with an official report as to the exact cause of death and help us to determine exactly what has happened.
And stay tuned to USVI News. Of course, we'll keep you posted when anything develops in that story. In the meantime, U.S. State Department says it is closely monitoring the investigation, too. Here's more.
There were some signs of individual presenting to the clinic with nausea, vomiting, and some symptoms.
The Bahamas health minister says it all began Thursday night. 2 American tourists at the Sandals Emerald Bay Resort complained they were feeling ill and were treated at a local medical facility. The next morning, the couple was found dead in their resort villa. The man, police say, was slumped against a wall. The woman was on their bed. Both showed signs of convulsion. Minutes earlier, police had found another man dead on the floor of his villa.
The third deceased is Vincent Paul Shirella, age 64 years, of the United States, and he's a resident of Florida. He occupied a separate villa with the female survivor and wife, Ms. Donna Shirella.
She was airlifted to Princess Margaret Hospital in the capital, Nassau, about a 30-minute flight away. Now health officials are waiting on autopsy reports to determine what caused the tourist's mysterious deaths.
Hopefully nothing's going to happen to us.
Jason Toth and Sydney Rosenquist arrived at the Sandals Resort for their honeymoon, one day after the victims' bodies were found.
It definitely gives me a cause for concern just because you want to know what happened.
It's certainly very irregular.
As a general rule, CBS News medical contributor Dr. David Agus says it's important to have access to your health records when you travel and to listen to your body.
If you start to feel ill and it's not getting better, that you go to an emergency room wherever you are. And if the treatment doesn't work, go back to that emergency room.
And officials with Sandals says its staff followed all protocol, alerting medical personnel and local law enforcement as soon as they were aware of the health emergencies, and they're now actively working to support the ongoing investigation.